All right, so here is the treatment section of schistosomiasis. I also wanted to just go ahead and briefly cover that even though schistosomiasis is the most common name for it, I did mention that it was also known as bilharzia, and this is because Theodore Bilharz was the first person to describe this disease in humans. So, just a little fun fact I wanted to throw in there. All right, so the current treatments right now, there is no vaccine for it as of now. And praziquantel, I'm sorry if I'm mispronouncing that, but this drug treats all types of schistosomiasis. And right now it is the only drug that is used to fight against this disease. After treatment, there may need to be surgery to remove any masses, tumors, ligations, or any large granulomas in the tissue. Most of these masses and tumors are going to be in the bladder or in the liver. And then here is what a tablet will look like. And I'll go into details a little bit about and how the patients are supposed to take this. So I'm going to go ahead and discuss the mechanism of how this drug works. So what it does, it paralyzes the worm, and then it exposes it to your body because, as I mentioned before, they're covered in your host antigens. So what this drug does is it paralyzes it, exposes it, and then they are attacked by your host immune system. So after adult worms are killed, they won't be able to lay any more eggs. And then this stops the whole life cycle, and then the patient just passes the dead worms. And then what the drug what helps is that it affects their membrane permeability of the parasites, so they won't be able to pierce through your skin or go anywhere else. And then it does cause evacuation outside of the parasite. All right, so the reason that this is right now the best option, and really the only option, is it's effective, it's safe, and it is low cost. The tablet is taken by mouth with warm water and a meal, and they take it just for 1 day, but in 3 doses. And then in between those 3 doses, they do have to wait 4 to 6 hours. Right now, the cure rate is 60 to 90%, and this doesn't mean that it completely gets rid of it forever and you can never get infected again. But for this one time, it will go away. You will be cured, but you're still at a risk to be reinfected. But if you are not cured, 90% of the egg excretion will be reduced. And then they do repeat this once a year, but it just depends how bad the condition is. But if it's reoccurring, then you definitely do it at least maybe twice a year for a couple of years. And then some of the effects of this drug is dizziness, headache, nausea, vomiting, and abdominal discomfort. Right now, another form of treatment that they're doing with this drug is they're doing mass drug administration to they're doing it to entire high-risk communities. I know the WHO have donated thousands and thousands of these drugs to go ahead and administer to these communities that really need it. They estimate the optimal dosage according to the individual's height, and then these communities are treated by the local health worker there, and they prescribe, I think it's 40 milligrams that I read, but this is a picture of people or kids in line waiting for the drug administration. So the response to treatment, I put here, here is a picture of what the parasite will look like once it is paralyzed and killed off. So this one right here is the male. You see it's much thicker and it's bigger. And then you see this one, this is the female. So they evaluate the response to treatment by counting the amount of egg excretion that has been reduced. The first 2 weeks after the treatment do not count because any eggs that were laid before or at the time of treatment still need to be shed. So they really start to count the decrease in egg excretion after those first 2 weeks. And they usually start any measurements 6 to 8 weeks after treatment. But they can test, they do a test that measure the antigens, and this one they can start to measure 5 to 10 days after treatment. They can also do stool and urine tests, and they do this one 6 months after the treatment. So they test this one for any type of particles of the parasite left. If after these measured eggs are still being excreted, then if they still see that eggs are being excreted even after the treatment, then they definitely do need to repeat it. And they just need to repeat it until all these tests come back negative and there is no more egg excretion. Another thing that I thought was really important, it's not necessarily a drug or any type of medication, but this is preventative medication. I think it's still important to definitely discuss. So prevention, they are trying to stop the sickness before it starts. It's important because as of right now, since there is only one drug being used, researchers fear that worms may become resistant to the drug, and there is no other alternative treatment. So they're definitely trying to prevent as much as they can. Right now, they're really focusing on preschool children or school-age children in endemic areas. They also are targeting adults that are considered to be in high-risk endemic areas or in occupations that force them to be in these infested waters. For example, any adults with occupation such as fishermen, farmers, irrigation workers, and women whose domestic chores expose them to high infested waters are definitely being targeted. I left a link here for the website that I was reading this from. It is it's a movement to eliminate schistosomiasis, and then these are just some of the things that they're trying to do in these endemic areas to prevent any more infection. All right, so the prevention mechanism, so they're trying to, there's lots of prevention, not just at one point, but at various points in the life cycle. First, they're definitely going to start with infected humans. They want to get rid of worms with medication, and then this way they can't, even if they do still pass on urine or feces into the water, if they're rid of the worms, then there's no way to spread. But let's say that they are infected, then another way, the next step would be they want to reduce contamination by not spreading any eggs, and they're doing this by educating proper sanitation and providing the necessary facilities in the areas. I've read about other places such as China who are trying to eliminate these snails altogether so that these eggs will no longer have a host and then they just die off. And they've done this by using chemicals and biological control methods, but the results have been variable, so there's not really anything concrete yet. But the next step after that would be reduce contact with water completely. It's not always possible, as I mentioned before. It's not something they're doing on purpose, but it's something that their occupation or their area is forcing them to do. But definitely in case of tourists, they are advised to not swim. Another important thing to discuss in treatment is resistance, which is what researchers are fearing right now, is that the worms will become resistant to the drug. Right here is something that I found in a case study looking into resistance. So it says PZQ action and calcium regulation can lead to potential drug resistance, and a strategy to maximize PZQ efficiency to overcome resistance in schistosomes. So they're going to go, They're looking at the potential drug resistance and what they can do to maximize the drug efficiency. they're trying to not let this happen, but they are getting prepared for if this happens, what else can they do? Drug resistance would arise if decreased levels of intracellular PZQ occur due to increased deficiencies in removing the drug by transporters, so multi-drug resistance.